Hello, my dear colleagues from Colombia. I wish I could be there with you. Today, I'm speaking on behalf of MERZ, and it's an honor to join this event. And I'm going to be talking a little bit about the treatment for the lower face. And we're going to start with zooming and how we can apply that to the lower face, a little quick literature review. And then I'm going to be talking about Contouring Plus, the protocol that I, together with other Latin and global speakers from MERS, developed as an algorithm for us to think on how to approach the lower face. So, well, my conflict of interest, of course, I'm a MERS Aesthetics Global Key Opinion Leader, and I'm going to be showing my opinion in this lecture, okay? So we're going to start talking about toxin, and we're going to start talking about how we changed the way we've been using botulinum toxin for the past couple of years. We started with the glabella, but now we moved to the lower face, and we're treating scars, and we're treating migraine, and we're doing microdosing as well. And I'm going to go through all that today. So I'm just wanted to give you a little reminder based on literature review on a few aspects for the lower face. First of all, when we're treating the orbicularis oris, we have to be very careful to avoid the Cupid's bow, because when we apply toxin straight onto the Cupid's bow, we have a tendency to flatten it. So we also have complications when we go laterally on the orbicularis oris, because it can, due to the dilution and the halo that you're applying, depending on the toxin you're using, you can reach the perioral muscles and you can have some complications there. So the idea with the orbicularis oris is that you go immediately, but you avoid the Cupid's bow. So this is why I think it's very important that you work with a very precise toxin such as Xiaomi. And the depressor angulioris is a muscle that it's really interesting to treat. I do it in almost all my patients because you can improve the smile and also the lines. But we do have to take into consideration that there are anatomical variations. And when we are injecting, the higher we go, the more effect we will see. But we also have the risk of reaching muscles that you don't want to, or getting an uneven effect. So it's important for me to mention that effectiveness will be higher when you go upper towards the mouth, but you will be safer when you go lower. So I usually start with 1 point more or less on the division of the thirds. And then if necessary, when the patient comes back, I would do a little bit more, maybe just 1 unit at the most, to be on the safe side, okay? For the mentalis, I had a few students coming to me and saying, like, hey, I've been injecting, but I don't see the results. I went to 2-3 units per point and I didn't see results. Not so much about complications when you go on the right area. So if you inject superficially 1 centimeter above the tip of the chin and 5 millimeters laterally, you will get good results if you're injecting superficially, because you're going for the cutaneous insertion, which is in the medial chin, right? So when you inject very deep, you don't reach the muscle. So this is why sometimes people are doing it and they're not getting good results, even though they're injecting more than 5 units. Okay, so you really don't have to do that. Usually I do 2 units on each point, but you have to go very superficially because the muscle here, the origin, is very superficial. So for the masseter, I think it's important to mention that we do have a very thick aponeurotic tissue. And if you're not using the right needle and if you're not doing the right technique, maybe you will inject on the wrong spot, right? What I mean by that is that I always choose a 13 millimeter needle, 30 gauge needle, but 13 millimeter, a bit longer. And although I know that it can be a little bit more uncomfortable, I don't put the needle really fast inside the tissue. I go very slowly to feel when I break the aponeurotic tissue to be 100% sure that I'm inside the muscle. Okay, so this is a tip that I would like to give you. And I don't know about you, but here in Brazil, we've had so many people suffering from anxiety due to the COVID situation. And I've been using more and more toxin for the masseter to avoid this hypertrophic state that it goes due to being anxious and all. So because of COVID, I'm doing it much more often. And I think it's very important that we take into consideration the use of a pure toxin when we do that, because sometimes our patient comes in January, for example, for the toxin of the upper third of the face. And then 2 months later, they will come back from their dentist and they will say, hey, I'm having some trouble with my teeth. And my dentist suggested that I did toxin. And then 2 months later, I'm applying toxin to the masseter. And then 3 months later, the toxin on her upper third is not, it needs a new session. So all of a sudden, I'm doing sessions every 2-3 months. So this is why it's so important that you have a pure toxin to work with. Because if they say that they want to treat their hyperhidrosis, for example, after 2 months, I can do it again. This is the only way to do it. So for the platysma, I would say it's important that we always go superficial. We should never inject below the thyroid cartilage because we have the risk of dysphonia and dysphagia because of the peripharyngeal muscles. So in this case, also very important that we can be precise and avoid, as Dr. Philip Levy shows beautifully in his work with the Nefertiti lift, that you should avoid applying especially deep and large amounts when you're near the cartilage. Okay, so this is also very important. Microdosing is also something that is being done, at least here in Brazil, a lot. Several doctors are using it. And of course, you need short intervals for that because you won't have an effect on rosacea for more than 2 months, 2-3 months when you're doing microdosing. And so you will need to be applying toxin every 2-3 months for these cases. And it's very important that you use a pure toxin such as Xeomin due to the resistance that we know that it's very much linked to intradermal injections. So the more intradermal you go with your toxin, the higher the risk for resistance to botulinum toxin. So this is also something that you have to keep in mind. So now that we talked a little bit about toxin, I'm going to go through contouring plus algorithm and how we got into that. And the same thing that I said about toxin goes for the HA fillers, right? So we went from nasolabial folds and lip fillers from 1 syringe per session to 10 syringes or 15. I've seen people doing 20 syringes per session when we're treating pseudoligaments and we're doing deep volumization. And then I ask you, would you think that HA alone is the right choice in the long term? I don't think so, because of several reasons, okay? First of all, this is work from Cotofana that I really like, about how the fat pads are arranged on the face. And we do see a lot of HA migration. I have patients coming from other doctors with some problems. I'm going to show you that. And there's a lot of migration when you're applying the wrong amount of volume with the wrong product, especially. So it's mandatory that we pay a lot of attention to rheology and also where we are applying that HA, right? Because when you have product migration, and this has been shown on several different papers, we do have poor short-term results, but we also have long-term complications. So I'm going to show you one of my patients that came after doing fillers with another professional. And she had 8 syringes injected on her mid face, and she came to me with the HA all over her lower face. And this is something that it's not that common, of course, but when you're applying it in the wrong way with the wrong product, you do have that type of problem. So it's something that we have to be very careful with. And sometimes you won't have these very evident cases, but we do see a little bit of migration. And this is why we see sometimes patients with more volume in an area that it's not related to the normal history of fat pads growing and shrinking, right? The other problem that we have with HA is adipogenesis. It can be a problem and it can also be something good. It depends a lot on your technique. So this is a paper that was published in 2018 talking about adipogenesis. And another paper that came out in 2019 was a very interesting paper by Nicholas Wilson that was done in vivo and in vitro with no conflict of interest. And that shows that HA can induce adipogenesis. So if you're applying it in the right spot, that's great. But if you're applying HA on the superficial fat pads and all over the face, you could have problems in the long term. So what has changed in my practice is both techniques, taking that into consideration, and also combination of therapies. This is something that is very important. I strongly believe that everything works better when you're combining therapies. So when we take a look at the aging face, we see a very different perspective on the lateral part of the face and the medial part of the face. And we do have a tendency to go medial when we're applying our hyaluronic acid, because this is where we see more problems. We see more laxity and less volume. But we do have to pay attention to the anatomy and what the best doctors are doing now. We have to pay attention to the line of ligaments. Okay, so we do have the temporal ligament, we have the zygomatic ligament, and we have the mandibular ligament, creating a line. So when we see this line, every time you're injecting medially, you will create a volumizing effect, but you're never creating a lifting effect. So if you need to volumize, that's great. But if you think that you're going to do lifting for a patient when you're applying on the medial part of the face, you really need to reconsider that, because we create the lifting effect by injecting laterally. That's where we have the high density of pseudoligaments. This is beautiful work done by Cotofana. And I've been putting it in my practice, and we've been having great results throughout the past few years, especially in the long term, and especially combining therapies. So I'm going to show you this case, which is a really hard case. It's a patient that has a lot of heavy areas here in the mid face. And we want to emphasize our treatment on the lateral part of the face. So in her case, I applied Radiesse Plus to do focal biostimulation, where we can create a lifting and contouring effect. And I applied a little bit of Radiesse Duo as well to create better texture and firmness as global biostimulation. So this is more or less the diagram, the scheme that I did for her. Where you see those red X's, that's where I'm not applying anything at all. This is something that I find really good about Radiesse, is that even when you're diluting it 1-to-1, you can still be very precise on where you want to treat. You don't want to spread all over the face. So this is a thing that it's amazing about Radiesse, is that you can really do a precise treatment, even when you're doing global stimulation. Global stimulation doesn't mean spreading product all over the face, not necessarily. So for her case, we did 2 syringes of Radiesse, one Radiesse Duo and one Radiesse Plus, and you can really see the improvement of texture after 60 days and the lifting and support that we can create as well. This is a young patient that I did 2 syringes of Radius, and after 1 year, you can see how you get better skin quality and also a kind of a lifting effect. And you can see it on the photo in the middle of the immediate result, where I exaggerated a little bit on the zygomatic arch. I was doing Radius subdermally. Okay, this is not needle to the bone. This is a very thin line that I do sometimes subdermally on top of the zygomatic arch. And in the long run, you can see a really interesting result. This is a patient that I did 2 syringes of Radius Plus only laterally, and you can see a really nice result on the medial part of the face due to the lifting and support and the biostimulation that can be done. So see how you can create a lifting effect by treating the patient on the lateral part. And here's a little tip that I want to give you. When you're doing the mandible, you always have to pay attention to the mandible angle. And in this case, I'm applying everything subdermally, and I'm applying a little tiny bolus. There you can see that little round blue dot. I'm tiny little bolus behind the mandible angle, because then we are not masculinizing her face, but we are creating a more acute angle. So when we do that, we can create this lifting effect and a very well marked line on her mandible as well. This is another patient that I also did a combination of therapies of Radies, Zooming, and Belotero. And this is throughout 3 years. This is all we did. And you can really see the difference in texture and volumization as well. This is the same patient. And we did have a very interesting effect regarding the thickness of her skin on the areas that I wanted to, not all over the face. Another patient that I did, that this is a follow-up of 2 years, applying Belotero and Radies Plus. And we can really see that I'm preserving the patient's authenticity, but I'm creating a very nice effect of lifting and contouring. So this is why we came up with this idea of doing the Contouring Plus algorithm, to make it easier for us to assess our patients. So basically what we have is we take into consideration if the patient has mild to moderate skin laxity. So if the patient has a lot of laxity, of course, it can be interesting for them to do surgery. We have to see in each case and if they want to do surgery. But for mild to moderate skin laxity, we have to see if it's present or not. If it's not present, it doesn't mean you shouldn't do Radius. You should, as prejuvenation. So if you don't have any laxity, you will do Radius Plus for prejuvenation. And you will see that with just 1 syringe per session, you create a very nice effect, because a young person's fibroblasts are working a lot better than a 60 or 70-year-old fibroblast. So although you're applying less amounts of Radius, you get really good results, and you're avoiding the laxity in the long term. And then if you want to do beautification, volumization, and projection for a young patient, of course, we're going to use Belotero. If we do have skin laxity, then we will always do Radius Plus for the contour of the lower face. And then if we need to do projection and volumization, then we will use Belotero. So it's more or less like this, the algorithm. And I'm going to go through each part and which products we use. So one thing that I find very important that everybody has to pay attention to is rheology. I know this is not an easy subject, and of course we want to see the treatments being done and that's it, but it's very important that we study rheology. Belotero Intense is the product that I choose when I do support and projection because of its normal force. So it's the ability of this gel to project, to push the tissue vertically. So this is why I use Belotero Intense. So it depends a lot on the area, and sometimes the same patient will need a little bit of both. Sometimes patients that I'm going to treat the same area, but they have different skin and different purposes, I'm going to be using Belotero Volume. Why is that? Because Belotero Volume is great for its plasticity and its balanced G prime. So you can create a lot of volumization, but you can also mold very easily. So for example, if I'm doing the lower face contouring, I can create the projection where I want to on the bone, and then I can balance the whole thing, creating a more superficial layer of Belotero volume on top. This is why it's so nice to work with these two products. And Radius Plus comes for the focal biostimulation to create that lifting effect that I just showed. And we're going to go through some long-term results as well for the Contouring Plus. So it's very important that everybody understands that Radius Plus, it's not a filler. It is a biostimulator that has got the characteristics of creating contour and a lifting effect because it works with focal biostimulation. So you create laxity improvement on very specific areas that you want to work with. And as I said, when we have a patient that has no laxity at all, we can already start using Radius Plus as prejuvenation. And the more sagging we see on the jaw, the more syringes we will need per session. But you do have to take into consideration that grades 3 and 4, it's something that you have to talk to the patient to see if they understand that surgery is an indication, okay? So as I said, we're using Intense for projection and support, and Belotero for volumization and shaping to create the final polishing for our work, right? As I will show you. When we're working on the mandible, I do definition of the tissue with Intense, and I like to go subdermal on the mandible body and the mandible ramus to create that through the pre-jaw with the cannula and through the mandible angle also with the cannula. When we're treating the mandible angle itself, then it's very nice that we go supraperiosteal with the needle or a 22 gauge cannula. It doesn't matter as long as you do it in a safe way. I like to use an empty needle, an empty 27G needle, because then I can be much safer regarding aspiration of blood, okay? And then if we want to do volumization and shaping, we're going with volume with the same axis, okay? For the chin, it's important that I mention an article that that was released on 2020. It's a very recent article, very well written, talking about bone resorption correlated to the amount of HA that it's applied directly to the bone on the chin, okay? So this is why we took into consideration when we created the Contouring Plus algorithm that we're going to treat the patient by layers. We're treating 3 different layers to avoid heavy amounts of HA directly to the bone, because that could lead to bone resorption. So we can create a very nice effect when we're using filler and Radius on 3 different layers. So when we're working on that area, I go to the periosteum with the needle. My personal opinion is that it's better and easier when you go with the needle. Make sure you aspirate. And I choose Intense on most of the cases, unless I have to volumize a lot. On the deep fat, I usually go with Belotero Volume, because on the deep fat, you're closer to the surface and it's nice to mold your HA. So this is why volume would be a good option. And when you're going subdermally, when you're very superficial, it's nice to use calcium hydroxyapatite. It's nice to use Radius Plus in that area, because you can improve the quality of the skin and you can reduce the wrinkles on the chin that you can also work with zooming together. This is something that I find very important to mention. I like working on the chin with HA and radius and zooming all at once, because when the muscle loses its power, you have better results and long-lasting results as well. So I'm going to show you a patient that I chose for this lecture. This is a young patient. She's 34, and she has very little laxity due to her age, but we are going to start with the prejuvenation for long-term results. So this is where I mark her for radius. We're going to do the entry point on the jaw area, but I'm not applying directly to the jaw. This is why I put these two red X's there, because this is the area that we don't want to place any product, because we want to create vectors to the medial part and to the lateral part to improve the contouring. So you don't want to apply HA or radius in that specific area. And then we do another point on the mandible angle to do our treatment on the mandible ramus. This is an area where when you apply radius, it creates a very interesting lifting effect, because that area is where we see the most pseudoligaments. And after we do the radius, I'm gonna do bilateral volume as well for refinement on the deep fat. And on the chin, we're gonna do bilateral intense to project a little. And on the labiomental sulcus, we can also apply to create lifting effect for the mouth. When we treat this area, we reduce the shadow underneath the lower lip, and this creates a very nice soothing atmosphere for the face. So I'm using Radius Plus, just one syringe for her, half a syringe per side, and I'm using it with a 22 gauge cannula. This is what I recommend everybody to do, is to use Radius Plus with a 22 gauge 50 millimeter cannula, because it's so resistant and safe. You can go very superficial, just pushing the cannula towards the surface. And after I'm done with the medial part of the face, where I'm applying just 0.2 more or less, I go to the mandible angle, and we're gonna do the same technique subdermally, but notice that I'm putting my finger to the mandible angle and I'm applying the Radius Plus behind it. This is a technique that I always like to do, because I can create an elongated effect without masculinizing the face, without having her face going from oval to square because of the product that I'm using, because of the amount of product that I'm using. So Radius Plus does not create a volumizing effect, which is great, especially for women. And when I'm working with men, then I will apply it directly to the mandible angle, my bolus. And on her case, I'm just creating the bolus behind the mandible angle so we don't masculinize her, right? So after I'm done with that, I go to the mandible ramus, and then I apply a little bit more. And I can also give you a tip on that part, because you can create a tiny little bolus where the hairline is. Nobody will see that bolus, but it will create a lifting effect for the lower face. So this is also interesting to be done when we're doing the contouring with Radius Plus. So now we're gonna go with bilateral volume for refinement on the mandible lines. And we're gonna go on the pre-jaw area with volume to get the surface more smooth with just a tiny little amount. And then you can notice that I'm going a little bit deeper, And we can go to the deep fat on the chin as well, to create a very smooth line to avoid any sort of shadows in that area. So I did 0.25 to reduce the shadows over there, and it's really easy to mold. And then with Belotero Intense, we're going to work with the shades, right? So I find very important that we don't treat just the chin or the lips, but we always should treat the labiomental sulcus as well, because this is an area where you see a lot of shadow being created, and this gives us a grumpy look. So it's important to treat that area. Never forget. She does have a scar underneath her lips, and I'm going to be treating that as well. In this area, I'm using a 27G needle, and I'm aspirating, but I'm very safe in this area because I'm applying very superficially, okay? So this is a way of creating a very nice reduction of the shadow underneath the lips without using too much product. And after I'm done with the labiomental sulcus, I decided why not treat the scar as well. And in this case, I'm still using Belotero Intense because the idea here is not to volumize this area, it's just to project the area where she has the scar. So I'm going to be using now on the pogonion and the chin. The rest of my syringe, we're going to be, I'm doing 0.25 ml on the chin directly to the bone, periostal, 2 points of 0.25. She's not a retrograde, so I don't need to project too much, but with just 0.25, we do create a very nice effect of the elongated and well-defined contouring. You can compare the right side of the face with the left, and you will see a very interesting result. So I'm just going through what we did here. 1 syringe of Radius Plus, we are doing 0.15, 0.35, and 0.25 for her. And with Belotero Intense, we did 0.25 on the periosteum on the lower part of the chin, 0.25 on the pogonion, and the rest we did subdermally, but still superficial with the Intense as well underneath her lips. And with Belotero Volume, we created 0.25 ml to reduce any sort of shading. And then I used the rest of it, 0.25, to go to the periosteum directly to the bone behind the mandible angle towards the back, right, to create a vector. So this is her before and after, and you will see that for a young patient that doesn't need a lot to be done, we have a really interesting result regarding the contouring of the lower face. I do have some other results to show you. This is a patient that we did the contouring plus protocol with 2 syringes of Radius Plus and 3 ml of Belotero. And what it's really interesting to see is that after 90 days, we have a much better result. So the lifting effect and how Radius reacts to the skin, stimulating the fibroblasts, you can really see that after 90 days, it's even better. This is also a patient from the protocol that we're going to be publishing with the Latam team, case of rejuvenation and beautification. She's a little bit of a retrograde. And so I did 3 ml of Belotero, applying on these 3 layers, and just 1 syringe of Radius Plus. And you can see that the quality of the skin and how firm it is after 90 days, it's also very interesting. So just for us to conclude this part, for us to avoid complications and poor results, I would say that to the mid-face, it's very important that we respect the line of ligaments and we inject our Belotero laterally if we want to do the lifting effect, okay? And when we're treating the medial part of the mid-face, then I think it's interesting that we prefer periostal points whenever it's possible to stay away from undesired fat pads, especially the superficial fat pads. because of the unwanted adipogenesis on that specific area. For the lower face, then I find it's very important that we always associate Radius Plus subdermally, and therapy is also very nice to stimulate collagen at a very early age when we want to give the patients definition and contour. Okay, very important that we treat by layers. We're not applying everything on the same area. Okay, so the chin is 3 different layers. So we can resume it more or less like this. If we're treating the lower face and we want to do periostal treatments, then I would prefer Belotero, because if I'm applying on the periosteum, I'm not getting the biostimulation that I can get with Radius Plus when I apply subdermally. So when I'm treating the lower face on the periosteum, then I want to go with Belotero, because then I will have a much longer lasting effect of projection and volumization. And when we go subdermally, then it's really important that we use Radius Plus to create that support and lifting effect, and we're biostimulating that patient. So when we do the follow-up, as I showed, after 2, 3, 4 years, you will see better definition without large amounts of volume of hyaluronic acid. So this is what I wanted to bring you of assessment, and especially how we should revise the way we do our techniques, taking into consideration that the combination of therapies is very important. Okay, so I'm gonna stay here for the Q&A. And thank you so much. If you have any questions, you can send me a message afterwards as well, if I'm not done with all the Q&A today. So back to you. Thank you so much.